Hi, Dr. Henry. My first question is, can the confident figure out which demographic is responsible for the rising cases in Northern?
Yeah, so it's not just one single demographic. We know there are very high rates of vaccination in older people. We are seeing some breakthrough in older people, particularly in long-term care homes. So we know that it's not enough for them to be protected with vaccination by themselves. And it's one of the reasons that we've started to give a booster dose to residents of long-term care. We know that the immunization rates are lowest in the 12 to 17-year age group, even though they have been eligible for some months now. And we are starting to see increasing movement in some communities in the 20s and 30-year-old age group and 40-year-old age group. But I will ask Minister Dix to address this, because I know you have the numbers off the top of your head for many of the communities in the north. I will say that what we are seeing now, though, it is unvaccinated younger people, people in their 30s, their 40s, their 50s, who are getting severely ill and sadly are dying, and they are unvaccinated people.
Please go ahead.
Thank you. And in terms of demographics, I think what you see across the province is that over 65 people have seen the highest risk of COVID-19 from the beginning, and have seen that especially in the first year of the pandemic, and then subsequent to that, we see relatively little differences between health authorities, such that over 65, it's about 93% of people in Vancouver Coastal Health, and 87 or so percent of people in Northern Health, which is a difference, but not a large difference. Where we see the largest difference is under 65 of adults, where the rate of vaccination overall across Northern Health is at about 79% today, first dose over 12, compared to, say, 89% or 90% in Fraser Health and 92% in Vancouver Coastal Health, 90% on Vancouver Island, and the mid-80s in the Interior Health Authority. So that's across the board. Where we see the highest differential is certainly in those categories of, for example, youth 12 to 17 and people in their 30s, people in their 40s, where we see a significant difference between Vancouver Coastal Health and the North. So I would say we need adults working age under 65. Many people work over 65, but between up to the age of 65 to increase vaccination rates across demographics in the North. And obviously you see different communities as well with significantly different rates of vaccination. Kitimat, for example, is in the 90% plus range and has been for some time. Prince Rupert is in the mid-80s, but other communities are lower than that, and we're making significant efforts. No community has raised its vaccination rate more than Fort St. John, but we're still at 72, 73%. We need that to be higher. And so what we're saying to everybody in the North is there is a path here. This is the frustrating thing for healthcare professionals, is that many of the cases we see in critical care today in BC, in our hospitals, people struggling to breathe, are preventable by vaccination. It's available in all communities, and everybody needs to do it. That is the path that we need to follow. Yes, the measures are important over the next month, but we need to continue to raise those vaccination levels. And if we do that, we can significantly improve the situation. But we have to continue to do that, continue to work on that, and I expect that people will. And it's time to get vaccinated everywhere.